Jimmy really loves letters. He loves numbers. He loves colors. He loves playing with other kids. He's just a real fun to be around.
Jimmy's always been a very tall, lean kid, and I noticed that he started getting a little bit of a belly when he was about 1.5 years. And I didn't really think anything of it, and people told me not to worry about it. He's growing, he's not even 2, just let it go. But that motherly instinct, I knew that something was wrong.
So our pediatrician noticed that there was something wrong with Jimmy's stomach. So she decided to send him to Monmouth Medical Center.
So I drove him to Monmouth Medical Center where my husband works. He met us there, obviously he was working there. And when he was sitting on the table, he kept having these dry diapers, which his teachers in daycare kept mentioning. Like, he had a dry diaper that entire day. And that's when I was like, okay, we're in the hospital already. We're in the best place. You know, now we're gonna find out what's wrong.
When the doctor walked in, I actually know the doctor, so I realized that, you know, this was actually a pretty tough time. This is gonna be a tough time for us because she's an oncologist, so I had a feeling it was gonna be some type of cancer.
When the doctor from Monmouth Medical Center came in and told us that Jimmy was positive for ALL, for leukemia, I was in deep anguish. I fell to the ground. I didn't know what we were gonna do. I was completely lost. But then when she said that we were going to go to Bristol-Myers Squibb, and the doctors from Rutgers Cancer Institute of New Jersey were going to overlook his treatment, I just felt this incredible wave of relief because I knew he was in the best hands anybody could have asked for.
So our oncologist is the best in the country. The pediatric surgeon who put Jimmy's port in, you know, he was 1.5 years old, and this gentleman did an amazing job. And not once were we really worried. I mean, obviously we're parents and we're worried about the surgery, but I mean, you literally have the best person doing the best job possible, and they're treating your kid as if they were their kid.
So when Jimmy was going for a routine blood test, Dr. Cole, his oncologist, found a gene that has a higher risk of causing a relapse. So without the collaborative care from Rutgers Cancer Institute of New Jersey and Bristol-Myers Squibb, they worked together and they made sure that he got extra chemo, and he worked with him for the entire summer when he was first diagnosed for 3 extra months. So they made sure that he didn't have to relapse again or relapse ever, and he will be fine. And this was it. And without that collaborative care, Jimmy wouldn't have had that chance to just go on and live a normal life and not worry about this again. My family has been amazing. My husband's family has been amazing. Jimmy's an only child, so he's spoiled before, but now he's really spoiled.
So what I'm really looking forward to is when we're done with therapy and we can actually go and do something with the family and maybe go out on a trip and enjoy ourselves and put this behind us.